Good morning and welcome to the JAXUSA Workforce Briefing on Healthcare. My name is Anna Lebesch and I am the Senior Vice President for Strategy and Talent at the JAXUSA Partnership. And it's my pleasure to welcome you here this morning as we get to spend the next moments together talking about a very important industry in our region that is very robust and very important to the economy of this region. First of all, I'd like to say thank you to our virtual sponsor, Ascension St. Vincents, as I introduce them as our keynote this morning. Joining us this morning is Tom VanOsdol, who serves as the President and CEO of Ascension, Florida and Gulf Coast. In his role, he has the daily clinical, operational, strategic, and financial responsibilities for Ascension's Florida and Gulf Coast ministry market, which includes the Sacred Heart Health System and the Sutter Family Children's Hospital based in Pensacola and the Florida Panhandle, the St. Vincent's Health System based in Jacksonville, and Providence Hospital in Mobile, Alabama. Throughout his career, Tom has had multiple administrative and executive leadership roles, along with numerous local board and community service appointments. Prior to relocating to Florida with Ascension in 2005, Tom served as a regional president with responsibility for multiple hospitals and statewide service lines for Ascension St. Vincent's Health in Indiana. We are extremely fortunate to have Tom here with us today to share with us the great work that's happening at Ascension St. Vincent's. Tom, I'll turn it over to you.
All right, Anna, thank you so much. And good morning, everyone. It is a pleasure to have an opportunity to share more with you this morning about Ascension St. Vincent's here in Northeast Florida. And we serve a region that includes Northeast Florida and Southeast Georgia. So it really is my pleasure to have this opportunity, and I thank you for it. If you go ahead to the next slide, please. Share a little bit fundamentally about who we were founded to be by the Daughters of Charity. And I'll share our mission statement with you. Rooted in the loving ministry of Jesus as healer, we commit ourselves to serving all persons with special attention to those who are poor and vulnerable. Our Catholic health ministry is dedicated to spiritually centered holistic care, which sustains and improves the health of individuals and communities. And we are advocates for a compassionate and just society through our actions and words. And I'll ask you to put a pin in that last sentence. We are advocates for a compassionate and just society through our actions and words, because I'll come back and bookend that thought and talk to you about how we're operationalizing that today at Ascension St. Vincent's at the end of the presentation. Next slide, please. So I mentioned we were founded by the Daughters of Charity in 1916. And for more than a century, our physicians and nurses and healthcare workers have dedicated their lives to providing quality, compassionate healthcare for those most in need. So we are in our 106th year here serving the individuals and families of our greater Jacksonville community. And it's certainly our pleasure to have that long history of serving this great community. Next slide, please. Here's a bit about our footprint, and we'll talk about how it's growing and expanding even as we are speaking here this morning. So today, we have 3 hospitals located throughout Jacksonville, soon to be 4, and I'll talk more about that in just a moment. We have 1 senior living facility, St. Catherine Labouré Place here, that is located adjacent to our Ascension St. Vincent's Riverside campus in the Riverside area. We've got over 120 clinic and practice locations, ambulatory facilities, physician practices, health centers, et cetera. And just in the last year, we've provided over $80 million in community benefit. That first line of our mission statement talks about special attention for those who are poor and vulnerable. That's one of the fundamental reasons that Catholic healthcare exists in this country, is to make sure that those who are struggling the most have access to the care that they need. And so this is a key marker for us in terms of our overall performance relative to how we are reaching out and serving those most in need. Next slide, please. So just a few of the vital statistics about our ministry. We refer to our organization as Catholic Healthcare Ministry. Our associates or our employees, we've got a little over 5,600. Our licensed hospital beds throughout the market are a little bit over 1,000. Each year, we perform over almost 25,000 surgeries. We see about 1.2 million patients for ambulatory or outpatient visits. We see almost 138,000 emergency department visits. We've got almost 37,000 folks who spend time with us in our hospitals. And all of that is supported by not only those 5,600 associates, but over 500 employed physicians and advanced practice registered nurses through our Ascension Medical Group throughout the broader Northeast Florida and Southeast Georgia community. Next slide, please. So we talked about our 3 hospitals, and here is a picture of the beautiful Ascension St. Vincent's Riverside Hospital, and I am speaking to you today from my office located inside this hospital right on the St. Johns River. Just an absolutely beautiful facility, 530 licensed beds, located at Barr Street and Riverside Avenue in Riverside, with the drive coming directly on the opposite side of this picture from Riverside Avenue into the hospital, named Surecliff Way, after the great Bob Surecliff, who was such a supporter and board chair and benefactor for our organization for so many years, and a role model for me, and I know for so many of us personally throughout the broader Jacksonville community. Next slide. This is Ascension St. Vincent's Southside, and I'd like to introduce you to the new Ascension St. Vincent's Southside. So this facility has been here for a number of years. We purchased it actually from the Mayo Clinic back in late 2008. But in 2016, with Hurricane Matthew, there was some damage to the facade. And we have recently, through our own efforts in engineering and construction, as well as working through the process with FEMA to provide some of the supportive funding, we have completely renovated and not only interiorly, but exteriorly reskinned the entire building. So it looks today like a brand new hospital. It's absolutely gorgeous, located on Belfort Road and JTB. This is a 308-bed hospital. And just, again, it's an absolutely beautiful site to roll up today and see this pristine, brand new building that really is. One of the things I said when we dedicated the building with the new skin was that we have now an opportunity for the exterior of the building to match the excellence that has always taken place inside the interior of the building in patient care. Next slide, please. This is our Ascension St. Vincent's Clay County Hospital, opened in 2013, and we are already planning what we call Clay 4.0. So we've had 3 expansions to the Clay County Hospital since we opened, and that was always planned to occur that way, that we would not overbuild initially, but we would expand incrementally as the growth continued to happen throughout the broader Clay County community. So our expansions over the years have included an expanded emergency department, new and then expanded labor and delivery facilities, expanded ICU and medical surgical beds, an additional cath lab, and expansion to our operating rooms and perioperative continuum. So just a beautiful hospital that continues to grow. And as I say, we're operating in 3.0 mode, and we're already planning 4.0 for continued growth at Ascension St. Vincent's, Clay County. That's at 130 beds today. And then this is the soon-to-be 4th Ascension St. Vincent's Hospital in St. Johns County, in northern St. Johns County. It'll be located at the Fountains North development, which is the northeast corner of I-95 and 210. And if you drive by there today, you see progress daily happening on both this building, which is the hospital building. That's what you'll see if you were traveling southbound on I-95 and you looked over to your left, just north of State Road 210, this is what you will see. And just to the north of this, or just to the left of this, if the picture were expanded in that direction, would be a large medical office building, which is also going up today. And all of this will open. The medical office building will open in advance of the hospital, but the hospital will open July 5th, 2022. So we could not be more proud and pleased for the opportunity to take our clinical expertise and care and caring and our mission to the great individuals and families of our St. Johns County community. So the next phase in the expansion of St. Vincent's across the entire Jacksonville market. Next slide, please. So Again, this talks about the facility. It'll be 56 beds initially with the same modular expansion capabilities that our Clay County Hospital had. So we are not overbuilding initially, but we are fully prepared to already be planning when we open St. Johns County 2.0 and moving forward. We're just going to grow right along with the growth throughout that great community. This campus for us overall represents a $172 million investment. It'll create 675 new jobs with an average income of just over $81,000. Again, offering 24/7 emergency and surgical care closer to where folks live and work. Convenience in healthcare is the name of the game these days, and we're taking our care and caring closer to where more folks are living and working. And initially, we'll have clinical specialties at that hospital that'll include cardiovascular care or heart and vascular care, neurology and neurosurgery, both brain and spine, orthopedics, pulmonology, general surgery, ear, nose, and throat, or otorhinolaryngology, gastroenterology or GI, cancer care, family and internal medicine, and pediatrics. And so we will be comprehensively serving the needs of the individuals and families of St. Johns County. Next slide is just over the last 6 years, during my tenure here, we've invested, we are all in on Jacksonville and Northeast Florida. This is a phenomenal community in which to live and work and operate our healthcare ministry, and we are all in, doubling down on our investment, more than doubling down, with just in the last 6 years, over $75 million invested in ambulatory, conveniently accessible facilities. I just mentioned the criticality of access and convenience in healthcare, and we are taking our care and caring off our campuses and out into convenient, accessible locations throughout the community to make sure folks can get access to the care they need. So $75 million invested just in our health centers, over $35 million in additional growth in our medical group, our physicians and advanced practice registered nurses who practice throughout the broader community. In the last year and a half, we've opened 2 community-based emergency departments, and those are absolutely thriving in the Arlington area and on Collins Road on the west side. And that represents an additional $40 million in investment, and we are going to just keep right on going. I talked about St. Johns County opening July 5th, and you'll just see continued growth and investment as we look to grow along with the organic growth that we're already seeing throughout this wonderful Jacksonville and Northeast Florida community. Next slide. Just a few things about our clinical services. So adding all of these up, these are our heart and vascular care services, some of them really highly specialized. The first one is transcatheter aortic valve replacement, being able to replace the aortic valve in the heart, not by opening the chest as was historically done, but by going through the radial artery in the wrist or the femoral artery in the leg, and simply being able to thread a catheter up and replace that valve, which so many individuals need. Just absolutely transformative technology in the way that these procedures are performed, and the recovery time, which is next to nothing, whereas it used to be, again, an open chest procedure. So we've performed just in the last year over 208 of those, and have performed over 1,000 over the course of the last couple of years. And then the Watchman procedure is a procedure that functionally eliminates atrial fibrillation, which radically reduces the risk of stroke in patients with atrial fibrillation. Again, 233 of those in just the last year, and well over 500 since we initiated the program. These are highly specialized clinical technologies that are accessible here from Ascension St. Vincent's as the heart and vascular leader throughout this region. And adding those all up on an annualized basis, we perform, our incredible doctors perform over 11,000 heart and vascular procedures, caring for the individuals and families of our community. Next slide. This one represents our hybrid biplane operating room, which is brand new at the Riverside campus. This is incredible technology. The panels, the sort of round arms and panels that you see there, actually rotate 365 degrees in 2 different directions, thus the biplane moniker, that allow our endovascular neurosurgeons to functionally be able to operate on vessels inside an individual's brain simultaneously from the inside of the vessel with a catheter threaded up into the brain and operating on the inside of the vessel. And at the same time, with a part of the skull removed, being able to operate on that vessel or proximal vessels exteriorly to the vessel itself through the brain. Just incredible technology and work, life-saving technology for folks with clots and emboli and aneurysms and bleeds in the brain. The devastating effects of stroke, embolic and hemorrhagic stroke, have been largely mitigated by the incredible work that these neurosurgeons can do. And this is a relatively new program for Ascension St. Vincent's. If you go to the next slide, we've got 2 hybrid endovascular neurosurgeons, some of the most highly subspecialized people in the world, 3.5 neurohospitalists and an advanced practice nurse supporting them, 8.5 outpatient neurologists, and nearly 5 advanced practice nurses all supporting them. And next slide. We did our first of these kinds of procedures that I was describing back on October 4th, and since we've already done 30 of them. You see EMS dropping a patient off with us, and we've had both ground and air transport bringing patients in for advanced brain care and stroke care here at Ascension St. Vincent's just over the last few months. Again, this is a relatively new program that takes our clinical service differentiation up to a new level and a new day for Ascension St. Vincent's, and a new day for individuals who need this care and otherwise, in many cases, would have had lifelong effects from the symptoms that they were experiencing. Next slide, please. We've also, under Neurosciences, got a multiple sclerosis clinic with Dr. Carlos Mora, one of its kind in our region for individuals experiencing multiple sclerosis, as well as a movement disorders clinic with Dr. Kurt Henschel for individuals with Parkinson's disease and Huntington's chorea and other choreiform or movement disorders emanating from neurogenic conditions. So really, again, advanced neurosciences and heart care at Ascension St. Vincent's. Additionally, next slide, advanced orthopedic and spine care. So we are in an exclusive partnership with Southeast Orthopedic Specialists and an oversight organization called HOPCO, which is Healthcare Outcomes Performance Company, for the provision of the region's most advanced orthopedics and spine musculoskeletal care. And you see the numbers of procedures that we do on an annual basis. They are significant. The surgeons are second to none. And bottom line is, if you need orthopedic or spine care, Ascension St. Vincent's is where you want to be. And in addition to this, you saw that brand newly reskinned Ascension St. Vincent's Southside Hospital, also one of a kind in our region, is the Performance Orthopedic and Spine Orthopedic Specialty Hospital located inside Ascension St. Vincent's Southside. And one more clinical service to highlight is our lung care. We've got the largest lung care group in the state of Florida, with our pulmonologists and in critical care intensivists and all of the others that support those incredible physicians, just doing some incredible research and some incredible work. And one thing that we would highlight here is what's called the Ion robot, which is it's robotic bronchoscopy, being able to robotically go into the lungs and identify and diagnose and excise nodules smaller than 2 centimeters, far smaller than anything that could be detected or definitively treated previously. And what it's doing is allowing for earlier diagnosis and definitive treatment for folks with very, very small emerging lung nodules. Historically, these would have to get much bigger before they were detectable and excisable. And by that point, the individual has much more significant health concerns that they're dealing with. So this again takes longevity of life and quality of life for folks with lung care issues out into a brand new horizon that was not previously achievable. And I'll bring it home and wrap up by saying these are, I love talking about those incredibly differentiated clinical services, and they really are exciting. They really are, some of them are just fascinating. They are so advanced and so sophisticated. And they're absolutely phenomenal, and our investments are phenomenal. And I could not be more proud of all of that. But it's interesting when I step back and think about all that technology and all those investments. Those are great things, but they're things that other organizations can do as well if they make the right investments and they recruit the right individuals. But what really, in my mind, makes the difference for us is our people. You know, folks can copy our technology, they can copy our strategic plans, they can copy our investments. They can't copy our people or our culture. And that's what truly makes Ascension St. Vincent's different. And so this next slide, and I mentioned that last line in our mission statement about being advocates for a just society. over the last year and a half, we've launched a new program called ABIDE, which is an acronym that stands for Appreciation, Belongingness, Inclusivity, Diversity, and Equity. And it really is about getting in touch with our people, hearing them, meeting them where they are, listening to them, helping understand what they are experiencing in the community and in the workplace, and how we can best support them in growing to be the fullest manifestation that, of themselves that God has created them to be, and eliminating barriers to them doing their very best work and feeling as though they are respected and appreciated and heard and engaged and included and valued in every step of their work with Ascension St. Vincent's and as they go out into the broader community. So what we've done recently are a series of listening sessions, just helping to understand what are our folks experiencing, what do they need, how can we further improve, how can we work to shape not only policies within our organization, but socially, that will help create greater inclusivity, diversity, equity, appreciation, and belongingness. And this is fundamentally our living in consonance with our mission and who we were founded to be. And it really is our people that make all the difference and bring our mission to life. And so with that, I will close. I really do appreciate, I hope that's helpful. Hope that gives you a little more perspective on the breadth and depth and heart of Ascension St. Vincent's. And it really is just such a great pleasure and privilege for me to serve in this great community alongside all of you and in this healthcare ministry with so many incredible doctors, nurses, and other caregivers. And so with that, thank you for the opportunity. Hope you all have a wonderful day. And Anna, I'll turn it back over to you. Thank you.
Tom, thank you so much for really sharing with us that perspective on the impact that St. Vincent's is having throughout our region, not only just in the growth of your organization, but in the innovation that's occurring within the organization. And as you said, the importance is also the people and the talent that you have and the opportunities our own talent have to work for an organization like yours. So thank you again for being our sponsor today. Next, I'd like to provide a kind of a snapshot overview of the healthcare industry in our region to give a perspective on the impact that this industry sector has. Health and biomedical is the largest sector in the Jacksonville MSA and the Jacksonville region. 1 in 6 jobs in the region are in this sector. This is a robust and growing industry, growing at a faster pace locally than it is at the national level. As a targeted industry, the focus is on growing this industry, particularly in the subsectors of biopharma, medical devices, medical research, and healthcare IT. Opportunities abound in this industry. The region's healthcare and social services options include some of the country's largest and most prestigious medical centers and health services organizations. There are over 5,184 healthcare and social assistance establishments in this region. This is a 54% increase in the last 10 years. And you see here some of the largest of those that are found in this region. As an industry, the majority of the employment can be found in our general medical and surgical hospitals and offices of physicians, which represents 54% of the industry's employment. The Jacksonville region is well positioned with a world-class healthcare system, making the region a healthcare destination for healthcare services. We have more than 10 major hospitals and medical centers, 1 of only 3 Mayo clinics in the world, and 1 of 6 MD Anderson Cancer Center partnerships, making this region a destination for medical services. The total industry jobs in our region is over 107,000 jobs. The health services industry has been growing on average of 2.7% over the last 10 years, which is a growth rate above the national average. In the last 12 months, there were over 70,000 job postings in this sector, with the most in-demand positions being registered nurses, personal care aides, nursing assistants, medical secretaries, and information clerks, and licensed practical nurses. Wages have also grown 2.4%, with an average of $59,260 across all occupations. But averages range from $25,400 as a personal care assistant to six-figure salaries as physicians and medical health services managers. As we look across the sector, 40% of the jobs can be found in patient care practitioner roles. 40% of the jobs, when we look at those job postings, 70,000 job postings, require at least a high school diploma or the equivalent, but less than a bachelor's degree. Another 41% of the postings did not specify an educational level. 19% require a bachelor's degree or higher. This industry is an industry that provides a multitude of career pathway opportunities, requiring a variety of training from entry level to certificate and certification to advanced degrees. And our school districts and colleges and universities provide many opportunities to enter and advance a career in this sector. To learn more about career pathways, visit earnup.org. Often overlooked is the business side of healthcare. 23% of jobs are in healthcare support roles, 17% in office and administrative support, and 4% medical and health services managers. So the business side of healthcare is also an extremely viable option for careers and career pathway opportunities. Innovation, best practices, problem solving, and patient care are all things pushing medicine forward. This industry is evolving and changing with virtual health, cloud-based technologies, artificial intelligence, and virtual reality spurring this change. So hopefully, as you can see, the future is bright in the healthcare sector in our region.